Howdy, I'm Scott Lindberg. I'm the Director of Liver Transplant Anesthesia at Houston Methodist Hospital, Houston, Texas. We've been using the HotDog Warming System now for about a year and a half. And we got to where we are today because our prior solutions for patient warming proved inadequate on pretty much routinely. Prior to using the HotDog, we utilized bear hugger, forced air warming. We used multiple different solutions: underbody, lower body, and upper body, and in combination, and sometimes as many as 3 machines on one patient. But we failed to consistently achieve adequate warming. Since moving to the HotDog system, we've achieved consistent and excellent results, often having to turn the heaters off towards the end of the case because the patients became too warm. Something I never achieved, even in the best cases, with forced air warming. Infectious risks are, a very complicated question. I think it's imperative that we maintain warming because it has been shown to decrease wound site infections by avoiding hypothermia. Looking at post-transplant mortality, infectious risks are routinely the number one cause of mortality in transplant recipients. That was a huge driver in moving towards a HotDog as our warming solution. With forced air warming, we had a break in our ability to warm patients from the time we started prepping until after the drapes were up for fear of, contamination of the field with the forced air warming. With the HotDog, we're able to actually place the warming devices in the position we want them for the entire case and activate them without a break at all and maintain warming through the period of time, prepping, draping, and straight through to the end of the case with no break. In my institution, it's in my experience, the liver transplant case has been the most difficult case to achieve consistent and reliable normothermia in. And to this date, the only product that has reliably produced normothermic conditions pre-incision and on discharge to the ICU has been the HotDog warming blankets.